Anders, I am a working radiographer, but I have worked in patient and public involvement within the health service for many years. I would like to come back to your idea of hub and spoke. I can't see how that can work in this area. I come from South Bucks. We don't have proper community hospitals there. We've got 85% green belt. We can't expand. There's nowhere to put things. You talk about expanding GP practices. From where I come from, you cannot expand a GP practice and put any more diagnostics or anything there. I'm also concerned that South Bucks has nothing in it and was not mentioned in your bigger picture.
In what way was it not mentioned?
It's very much on the periphery of where you had your big picture. And
Sorry,
we're still... Put that map up. Now, South Bucks is Farnham Road. We do not have services in that area, and there is no room to put them. Community hospitals' ability to expand GP surgeries. There is no room to put those hubs in that area. And that's the area I know. I suspect that would happen in other places. We've seen community hospitals in this area close. We've seen beds get less. I can't see how you can provide those hubs, and that worries me.
Okay.
Those spokes, not hubs, sorry.
Right. First of all, the hub is pretty much where most of the beds will be, because that's where the care will be, because most of the hospitals, such as Wycombe or Upton, do day surgeries, so the bedtime will not be, there won't be so much pressure on that. Secondly, I'm not about producing any more community hospital sites.
Why not?
Because you've got one in Henley, you've got one in Wycombe, you have one in Marlow, you have Bransford in Bracknell, you have King of the Seventh in Windsor, you have Upton Hospital in Slough.
And that provides nowhere for a patient in Beaconsfield to go.
Right. Beaconsfield, the challenge with this model was always in the Gerrards Cross Beaconsfield area. Okay, always was. The hospital that's not mentioned on here is Hillingdon, which is 15 minutes down the M4 from Beaconsfield. And also, as you will see, I don't mention Stoke Mandeville, which is straight up the road via Amersham. The need for a community hospital site in Beaconsfield is probably there. I don't deny that. A community clinic, not really a hospital, it's sort of a clinic.
A primary care facility.
Exactly, and I think that's something that maybe people should look at, because there used to be a hospital on Candlemas Lane, as I recall, in Beaconsfield, and it would be a good location for those facilities. But in effect, the model of healthcare provision is going to be pushing out GP surgeries. It's going to be pushing away from. The way in which we deliver our care is changing. It's increasingly becoming community located. All of this, the idea is to try and retain some of the sites we have and also sell off others in an attempt to provide sort of day surgery and the sort of community services that can be done in that environment. You make a fair point about Beaconsfield, but the difficulties I keep going back to is that when you sort of start like this, where do you start? I think Beaconsfield and Gerrards Cross has a need of some sort for some sort of community-based clinic. The problem you've got over there is most of the money got sucked into the PFI disaster that was Amersham Hospital. And that's, I'm not responsible. I mean, I found that whole development quite inexplicable. So you make a fair point about that particular area. The rest of the region, I think, is fine.
Can I add to that then? And this is, we are in the process of looking at a development in Beaconsfield at Wilson Park, the old MOD site. Now, with some help.
I used to live in Beaconsfield.
Okay, with some help from the NHS and primary care people in the area, that is an excellent site to put a primary care facility.
Yeah,
because
sure.
we're going, and I would love that to be done.
I can't do a complete sort of
I know.
out of everything, but I recognise that area. Gerrards Cross you know, obviously we'll be up in arms, Wrexham Park closing and putting a housing estate there, and I understand that, but Gerrards Cross can get to Hillingdon quite quickly. Hillingdon itself probably would need to be developed and be made larger, but this goes back to what I said at the start about a need for a national plan, and for actually people to sit down and go, right, where are the motorways, where are the sites, how can we do this in the most cost-effective and efficient and fair, and I hate the word fair, but that's as the majority of people can access it relatively quickly, and that's the problem with doing it in just one region. But you make a fair point about the Beaconsfield area.
Thank you. Can I ask, do you think Dr. Lee's plan would actually be a retrograde step for you, or just preserve the status quo, and wouldn't we go far enough?
For many years, I have wanted to see a hub hospital, but I wanted to see it on the M40 corridor, not the M4 corridor.
Okay. I mean,
and I've always thought that the M40 corridor was where we should
and it may be that that's, if you did a national plan, that's where it should be.
And I agree with you, we need a national plan.
You know, I sort of, as I said, I keep going back to this, from where I was, the sort of area I was taking, it would have to be the M4.
I've never seen a natural fit between Wycombe and Stoke Mandeville.
So do you think Dr. Lee's plan would make it worse, or just wouldn't make a difference?
You're pushing me there. I still prefer the M40 to the M4.
Okay, I won't push them. I'll ask any more questions? Man behind.
David Abbott, member of the public, Loudwater.
Good evening, sir.
Your insistence on the hospital being close to a motorway is flawed. Why? Because people don't live on motorways. They live out in houses in local areas.
So where would you
it's going to take as long to get to the motorway, and there are only limited accesses to the motorway,
okay.
and it's getting to a point.
Okay.
What's the point of having to drive God knows how far to get on the motorway to get to the hospital?
Okay, so you accept that to build this hospital you've got to serve 500,000 people. So where would you put it if you were serving 500,000 people?
Keep the small hospitals, the local ones.
So, in which case you've not listened at all to anything I've said.
I have.
But no,
How
you
much?
haven't, sir.
You quoted 2 million. Sorry.
No, but
you
haven't, sir,
quoted
because it's all
£2 million.
All of my statistics have been about how clinical outcomes have improved by consolidating services onto fewer sites. So, if you don't agree with that, that's fine. But if you do agree with actually having better clinical outcomes, then by definition we need to have hospitals serving larger populations.
And the other thing is, you made a statement that the National Health Service is costing £2 billion a week. Now, how much of that £2 billion is going on PFI and not on the National Health Services?
Well, I don't know. You should ask somebody people who introduced the PFI, because it wasn't me. I don't know what proportion it is. It's pretty criminal what's happening with PFI and health service. And a colleague of mine, a Conservative colleague of mine, has been trying desperately to get them renegotiated. Actually, there is some financial sense in buying out PFI contracts because they're so dreadful. But, you know, I'm not an expert on PFI, sir, but I know that they're disgraceful. But I'm not going to claim for 1 second that if we sorted out PFI, suddenly we'd have a sustainable health service. We wouldn't. So.
Okay, I mean, that's an interesting point, but Dr. Lee said there seems to be a big gulf between Dr. Lee, the district model of the district general hospital is dead, and lots of members of the public that we talk to every day in, day out want it restored, services back at Wycombe, and here time and again. And
what I would say, sir, is if you could do that, and I would challenge you that you couldn't, but if you did that, clinical outcomes would be poorer. So if you want a hospital that's close by that you can get to, but it's not as clinically good as it could be, that's a choice you make. I'm all in favour of informed choice, sir, but I'm suggesting that you wouldn't get the best hospital for your community by siting it in Wycombe. You have to site it in an area where 500,000 people can get to it, which to my mind means it's got to be on a major trunk road. Because you've got to have 500,000 people together.
Okay. All right. Can I, Councillor Greensby, straining at the leash here, do you want to ask a question?
Thank you, Chairman. Dr. Lee, you've given us a fascinating amount of statistics, most of which I have to admit I can't remember. But to me, there's a difference between emergency care and elective stroke specialist surgery. And I fully...
between emergency and elective.
Yeah. Well, and specialist, I think, to some extent. I accept that some A&E can lead to the need of specialist thing. But a lot of A&E is basic patching and mending. In percentage terms of the customers through the door, I'm talking about. Not...
if you're properly sick, sir, you want to go to a department that's properly staffed and equipped with departments behind it to treat you.
Well, I mean...
That's an idea.
What I'd like to say is I fully support that for specialisms, we are moving into an area where you're not going to get one in every town. You know, we're moving to hospitals that have a wider catchment area. On your hub and spoke process, and indeed following what you yourself said you did for your father, I mean, I'm quite happy with the specialist hospitals in London. Because that's where the spoke is, on the transport link. We are a rail nation that has rail links, and I can get into London quicker by public transport than I can get to Stoke Mandeville or to Junction 8-9 on the M4. You seem to be totally geared to motorways and vehicle traffic rather than other forms of public transport. And I think
no,
that's
I'm not geared to cars. I'm cars and buses, yes. I mean, I think, but realistically, so the train gets you often from where you're not to where you don't need to be.
But I mean, if I need
I think you can commute on the train in Britain. The idea that we're going to have rail services that can get us to hospitals, I love that.
But it's not only the. I mean, if I go in somewhere for specialist work, I don't really care where it is. I want the best.
Yes, which is what my
clinicians that are available to me.
That's what my statistics back you up.
And if that's in London or Bracknell or Aberdeen, I don't really care. My nearest and dearest may care because they may want to come and visit me.
Yes.
And the point I'm making is it's easier. A lot of people in Wycombe, it's seen as an affluent area, but a lot of people don't have their own cars. Have to rely on public transport, and it's actually quicker and easier to get to London than it is to Stoke Mandeville, or especially Oxford, which seems to be getting a lot of our medical traffic these days.
Yeah, because it's a specialty.
So why don't you include London in that plan? And I can fully understand it.
But there's always going to. So I mean, there's always going to be a need for tertiary referral in very, very specific areas. Okay, paediatrics has a lot of tertiary referral because you have very specialist paediatricians, for example. So there will be patients around here who are under the care of Graduate Street, for example. I'm not suggesting that this model will remove the need, the occasional tertiary referral to a very specialist centre, because we're not at that stage. I'm just suggesting to you that if we went with one of the benefits would be that you would get the majority of your care required by the majority of the population closer, so you wouldn't have to commute to Oxford and you wouldn't have to commute to London. And but actually that's not the only reason I'm suggesting that this model is inevitable, and is actually is really all that we can do in order to provide the very best care in the future.
I mean, I just think it's the wrong site as far as Wycombe's concerned. I mean,
well, where's the right side?
Well, for accidents.
So where's the right side?
Well, Wycombe. I mean, accidents and emergencies, you need immediate service.
Without wanting to accuse you of being parochial, sir, the middle of Wycombe is not as accessible for 500,000 people as either the M40 or the M4. And yes, you could make an argument for being at Andy Cross. I'm not suggesting you can't.
You said...
You can't have downtown Wycombe or downtown Bracknell or downtown Aylesbury.
You said that no hospital on there is on a dual carriageway or a motorway.
It's not.
Well, last time I looked, Marlow Hill was a dual carriageway linking to a motorway.
I think we're being a bit...
I'm being accurate, I'm afraid.
Well, actually, no, the entrance to the hospital, sir, we're going to be pedantic, is on a single-lane carriageway, because I work there.
Well, the exit
but the point is that the idea at the bottom of Marlow Hill is the appropriate location for a hospital to serve 500,000 people. I would beg to differ.
Well, all I say, why can't we split it so accident, emergency, urgent care can be carried out at places like Wycombe? The specialist referrals can be done in your hub hospitals where there is the specialist care. And I accept that there will be some A&E
but that's not how it
works. That will then have to be referred to another...
That's not how you staff medicine. It's just not how it works. The same person, The same person who's doing the specialist surgery.
It's worked for years.
No, that's my point, sir. First of all, it hasn't worked for years.
Well, it's been carried on that way for years.
Yes. And the idea that suddenly we've arrived at this stage of needing specialities within different sites, I'm sorry, it's been like that for 20 years. It's been like that for ages. Since I was medical school, there were surgeons who could do one operation, not others. We are so far behind the time in that regard, particularly the public's understanding of that, which is part of the challenge for me. But medicine, the staffing of medicine, the staffing of surgery, would not allow what you're describing.
But don't you think there's
However
a
much
risk
you want it, you just couldn't do it.
that people are not going to seek medical support when they should? I mean,
Why?
I'm
not advocating.
I'll give an example of what happened to me. On Friday, I slipped over in the ice
Yes.
and knocked myself out.
Yes.
I should, according to NHS Direct, have gone to A&E.
Yes. Stoke Mandeville.
Yeah. Well, I wasn't going all the way up to Stoke Mandeville.
Sure.
Not least because Stoke Mandeville had been publicly telling people to keep away because it couldn't handle the number of patients it had.
Yes, which is encouraging because that happens.
If it had been Wycombe, I could have gone to.
Because Wexham Park says the same.
If I could have gone to Wycombe, I would probably have gone. But I knew because it was a head thing, if I had presented myself at the urgent care unit in Wycombe, I would have been told to go to Stoke Mandeville.
If you went to Wycombe, sir, the people who could care for you if you had a problem were not there.
Well, they could have taken an X-ray, they could have...
No.
Well, then my argument is they should be there.
And actually,
that's the difference.
You touch upon a subject that's actually quite sensitive, because what the public thinks it's got in its local hospitals, I'm finding, is actually quite far removed from what it actually does have. And I certainly have this problem in Bracknell. You know, Heatherwood Hospital is viewed with much affection, but Heatherwood Hospital hasn't been a proper hospital for over a decade. I was encountering people on the doorsteps telling me how they went there with their heart attack, their stroke, and I was thinking, well, I hope you didn't go there for those things. Because I used to work there in out of hours as a GP, and they'd come in from the minor injuries unit and ask me for some advice because there were no medically qualified people on call. None. It was me, the GP, in the out of hours room. So which also, incidentally, is probably where Wycombe's going to end up at this rate. I mean, Wycombe, I don't know what Wycombe's doing with its out-of-hours cover because I stopped working with it because I just didn't like working.
I think that's one of the confusions that not many of us do now.
And I say to you, sir, that this is the problem, is that it's such a complex issue. There's a lot of issues involved, lots of statistics, a lot of understanding of how medicine and surgery is, and not surprisingly, the wider public are going, well, hang on a minute, I just want my local hospital to be a good hospital. And what I'm trying to say is you can't have that. It's not possible, and it's not about whether you voted Conservative Labour. Some of it's to do with money, because we're an ageing population, so healthcare is eating up more and more of the economy's what we can afford. But it's actually to do with the way in which medicine and all the ancillary sort of support staff, how it's gone. And some of that's positive, because we can now do so much more. But it does present us with some real challenges within the current infrastructure that we have.
I mean, I just don't see that your proposal, people are going to go there any more than they're going to go to Stoke
What I would suggest
if
is
you have to drive for half an hour to get to an A&E, you're not going to...
If I had the power, sir, what this would give you in Wycombe is better care, but you would have to travel 10 to 15 minutes down the bypass. I am convinced of it. If I was not convinced of that, sir, I wouldn't be giving up my
I think your timing's wrong. It takes my constituents 10 to 15 minutes to get to Handy Cross, let alone get on the motorway links and down to...
I mean,
can I say this is...
Sorry, can I have you had Dr. Gamble at the back has indicated she wants to say something. I think it's probably a good time to bring you in now.
Thank you very much. Yes, my name's Annette Gamble. I'm a GP. I've been a GP in Wycombe for 27 years. I am... sorry.
I'll run down.
Thank you very much. I am the Chief Clinical Officer of Chiltern Fishing Group. We are a group that covers the areas from Great Missenden, Amersham, Cheshire, Gerrards Cross, Stoke Church, Wigan Green, Bourne End, Wycombe, and down to South Bucks, Ivor and Burnham. straight away at the outset that as a clinical commissioning group, Chiltern has significant concerns about the impact of this hospital on our population. But whilst we have those concerns, we recognise that your proposals, Dr. Lee, are a serious contribution to what's a necessary debate about the future direction of health services in this area. We wish to engage in this debate in a constructive and meaningful way. I'm grateful to Mr. Cohen for allowing me the opportunity to clarify our views. We've got 4 areas of concern, and I'll just briefly describe those. One is the impact on the local hospitals, the other hospitals, that's been touched on. So because of its scale, the Royal Thames Valley Hospital would have a significant impact on acute hospitals beyond East Berkshire, and in particular Bucks. Shift of services to the new hospital would significantly reduce the level of acute hospital services that we have in Buckinghamshire. So those that are provided at Wycombe Hospital, and would reduce the population by 50%. 50% of Bucks population would go to this new, the catchment area of the new hospital. So Stoke Mandeville, further north, would basically not be sustainable because of the critical mass that Dr. Lee has talked about. So it's likely to have a domino effect similar to that which we've seen in other parts of the NHS. And for Bucks, that means we